Welcome, everyone. Good morning, good afternoon, good evening, depending on where in the world you are joining us from. My name is Laurel Grodman. I'm Managing Director of Admissions at the Yale School of Management. I am also a proud graduate of Yale SOM, class of 2006. And so I'm so excited to welcome you here tonight. And I'm so excited to be back in the classroom myself with Professor Mushfiq Mobarak, who's joining us tonight. I will start with a brief introduction. I will also give a brief warning. The New Haven area appears to be having some internet challenges tonight. So both myself and Professor Mobarak are doing the best we can, but I apologize in advance if we have a couple of glitches along the way. Hopefully nothing too intrusive. So I will keep my opening comments very brief with that in mind. But I would like to once again welcome Professor Mobarak, who is a professor of economics at Yale University with concurrent appointments in the School of Management and the Department of Economics. Professor Mobarak is the founder and faculty director of the Yale Research Initiative on Innovation and Scale, YRISE. He holds other appointments at Innovations for Poverty Action, the Jameel Poverty Action Lab, JPAL, at MIT, and the International Growth Center, IGC, at LSE. And so without further ado, I'll welcome you to our Yale SOM Masterclass titled Supporting Evidence-Based COVID Response Policies in Low and Middle Income Countries. So once again, welcome Professor Mobarak, and I'll hand it over to you.
Thank you, Laurel, for the kind introduction, and thank you everyone for joining tonight. We hope to welcome you to the Yale campus at some point, and it's in this difficult year, it's great to connect remotely. So what I'll do today is I'm going to try and just give a brief overview of the work we're doing since the COVID crisis started in the United States and around the world, on how, trying to figure out how can we be helpful and responsive to the needs of governments who are trying to tackle this crisis, and how can we facilitate some evidence-based policy responses. Okay? But before getting into that, I should probably just give you a couple of minutes on what I normally do, pre-COVID, what my life was like, and that'll also segue into, how we adjusted our research strategies, work strategies, in order to be helpful and responsive to governments. So I'm a development economist, which means that I work on economic issues in poor countries. What drives all of our work is, why are some countries poor, others rich, and what can we do about the fact that there are some countries that are poor, there are some people who are deprived, and can we address those challenges? And the specific line of work within that that I pay most attention to is this observation that for important classes of development challenges, there appears to be technically effective solutions available, right? So just to give you a few examples, the malaria is thought to be an important cause of low growth rates, underdevelopment in sub-Saharan Africa, right? And there is a technically effective solution that reduces malaria transmission. It's an insecticide-treated bed nets, right? Similarly, respiratory infections, the WHO claims is responsible for almost a quarter of all infant mortality coming from non-communicable diseases. And there are technologies that help with that as well, because that respiratory infections is linked to indoor air pollution, and we have cleaner burning cook stoves that produce less air pollution. Right? Similarly, diarrheal diseases is an important problem, especially in South Asia and in India in particular. And there are technologies that help prevent diarrheal disease transmission. It's a toilet, right? We understand the technology, but of course, for it to work, you actually have to use it. And something that surprises many SOM students, as well as people applying, is that half of all rural Indians still continue to practice open defecation. They're still going out in the open, right? And the Indian government and other partners have tried to work on this problem for years and years. And it's not just a problem specific to India, it's true for many developing countries around the world, open defecation. So now, these are examples where technologies are available. Now, the problem seems to be that even though the technology is technically effective, when we try to market it, when you try to get adoption, wide-scale adoption, that's where we often face challenges. Like behavior change is very difficult. People have constraints. There might be financial constraints. There might be informational constraints. There might be other things going on. Decision-making within the household, they might be risk-averse. So I try and understand, what is it about the household decision-making process or a community decision-making process that prevents people from adopting and using technologies, products, or new behaviors that are apparently welfare improving, that are, that we would think from the outside are sensible for them to invest in. And the way I go about, tackling those challenges is, so let's say I am puzzled about why people aren't switching to cleaner cook stoves, or why aren't farmers in South Asia, in rural areas, purchasing rainfall insurance when their livelihoods are at great weather risk, right? Why don't people migrate away from like famine-prone rural areas and into places that offer job opportunities during those lean periods, right? So when I'm puzzled about these things, what I end up doing is I end up running projects in a number of countries around the world, and where we market that product, but we carefully control and vary how we market it in order to study what works or what doesn't work. And that way we get an understanding of if we were to try and tackle this problem at large scale, right? What are the strategies that seem most promising that we should use? Yeah. So that's what I've been doing for the last 10, 15 years. But recently I've gotten, what happens is, so once in a while you hit upon an idea or a technique or strategy that seems to work, right? And so at pilot scale, when you run these programs, you see that, it is successful at behavior change. It seems to improve people's lives, right? And at that point, the question then becomes, okay, now that we have an innovation that might work, how do we scale it up, okay? And there, a lot of complexities might arise. So just to give you a quick example, like one of the strategies that I found that I've been working on for about 10, 12 years is to subsidize and encourage seasonal migration during lean periods in rural agricultural areas, like encouraging people to move to the city and work for a few months during a period where there's not much to do in rural areas and wages are very low. And then the question came up from very nice philanthropists, okay, why don't we scale this program up, right? So then at that point, I started thinking about, okay, what about scaling? And my initial reaction was, look, I showed you these results with a sample of 2,000 households. We really did it at pilot scale in only 100 villages, right? Now, if you start inducing 20,000 people or 200,000 people to migrate during this period, you might not get the same thing. And there are systematic changes that might occur. So for example, if a lot of the skilled people leave from the village, maybe other people in the village who are unskilled will be worse off, right? Or if at 200,000, if a lot of people show up in the city at the same time, that can strain the absorptive capacity of the city. It might change wages, it might change prices. It might, the migrants might bring back diseases to the rural areas, right? It might change the relationship between the husband and the wife, or the father and the children, because it's usually males that are migrating. So there's a lot of complexities to work through. And that, kind of was the seed for the idea behind this organization, Y-Rise, where we are now systematically thinking through the complexities of scaling up and how do we conduct rigorous research to inform decisions about scale up. Yeah. So that's what I normally do. And so come March 2020, so this is what I've been spending my time on, and suddenly the world's completely changed. And so we immediately halted all data collection activities, all research activities, because we didn't want to put our staff enumerators that we have in many countries around the world, in Bangladesh, in Nepal, in Chile, in Sierra Leone, in Malawi. And so it was an abrupt halt. And then, at that point in sort of mid to late March, the virus had already hit the US and New Haven, and it was clear that it was going to hit the developing countries sooner or later. So at that point, I started wondering, what can we do to be helpful? Okay. So I'm going to mostly talk to you about that today. And, I'll spend a lot of time on this one slide because it gives an overview of the various things that we're doing. And if I just get through this one slide and then we stop for questions, I'm happy with that. Or maybe I'll just give you the overview, tell you about one piece of research, and then we'll open up to questions, and I'm happy to take questions on anything that we discuss here. I just won't go into the depth until I hear what the questions are. All right, so the first thing I realized was, I'm from Bangladesh, and so I have deep connections there, and now very deep connections to the government, because we are now in sort of responsible for all of the socioeconomic tracking of this crisis for the country of Bangladesh. So I realized that, look, we're hearing all these stories about, contact tracing, et cetera, and data-based ways and large-scale testing. That's the way for us to get a handle on and tackle the crisis. And we're not going to have that the luxury of such sophisticated data in Bangladesh, especially in rural Bangladesh, anytime soon. Right? So it might even be difficult for us to track exactly where the disease is, where it's spreading, right? So given that we had all this research infrastructure, we had a bunch of enumerators who couldn't now go out, right? We also had samples. We had been collecting data on large numbers of people around the country, right? And those samples, we also understood their representativeness. So we could like make statements about the population or knew what types of statistical adjustments we need to make in order to make population level claims, right? So given that all that infrastructure already existed, right, we thought, okay, we also, given that we had been doing surveys and talking to people in person, we have their phone numbers because a lot of people now have cell phones, right? Why don't we just repurpose all of our infrastructure and deploy them in order to do phone-based surveys? So that's what we started doing in late March. So we kind of, all the enumerators who were skilled at asking questions and surveying, right? We started making hundreds and then thousands of phone calls each day in Bangladesh, and then we replicated that same process in Sierra Leone and in Nepal as well. Right? And so we were collecting a lot of information on what. So one is, I realized we wouldn't have testing. So can we make indirect inferences about the likelihood that the disease is present? And the way we did that is that in mid-March, even Yale did not have sufficient testing in place. And so the Yale Global Health Institute, as well as the Yale Health Plan, where we get our healthcare, they had developed this little algorithm of like asking about some symptoms that positively predict COVID and other symptoms like say nasal congestion that negatively predict COVID to try and make an indirect inference on the possible probability or the likelihood of COVID. And so we just deployed that around the country in Bangladesh. So that's about like some medical data on symptom prevalence, so doing some syndromic surveillance. But then it was also important for us to look at public health behaviors. All right, are people social distancing? Are they following? Are they adhering to the guidelines coming from government and others? And what about their knowledge? Are they wearing masks, etc.? Okay. And then it was also clear that pretty soon this was going to become an economic crisis and not just a public health one, right? So we started collecting information on employment shocks, income shocks, what's happening to food security. Are people now reporting not getting enough to eat, going hungry, missing meals, or cutting back portion sizes, or limiting the types of food that they get to eat? What's happening to food prices? Are we seeing any localized price shocks that we need to be wary of, right? And then we are also started collecting information on migrants and where they're returning to, because humans are the most important vector for this virus spread. And so migrants play an outsized role there, right? So we're collecting a lot of data at high frequency in order to guide any policy responses, because that basic data, needed to be collected. And the reason it needs to be collected in countries like Sierra Leone and Bangladesh is that, you cannot just rely on administrative records, right? It's because large parts of the population are in the informal sector. They're outside of formal administrative records, right? And so if you really need to understand what's happening in the country and make design policy, you need to talk to people directly and talk to people in such a way that you're not relying on any kind of formal institution. You're just like sort of directly creating your samples. So now that we're making all these phone calls, the other thing that occurred to me is that we could use some of these phone calls to also run intervention and not just collect information. So let's pass on good information about the disease to counter some of the stigma and some of the misinformation, because while in the first week I was worried that there's people weren't taking the disease seriously in Bangladesh yet because it hadn't hit yet, but by the third week the worry, if anything, was the opposite, which is people were taking it so seriously or being so misinformed that they were stigmatizing people who might have had any kind of symptoms. But then what happens with that is that people start hiding information, right? Because if you're going to get stigmatized, you're not going to tell anybody you have symptoms, which makes it even harder to bring the disease under control, right? So then we started, passing on information in two different ways. So one is we collaborated with the government to get a database of school headmasters, village imams at mosques, who would be who have microphones, and people listen to, in order to pass on information to them and asking them to pass it on to others. We also passed it on to regular people and then started experimenting with, should we be providing some incentives for people to pass on information, right? Things like that. So in addition to data collection using phone calls, we were also running some interventions. Okay? And then other types of data, like administrative records that were really helpful, were things like, okay, so now if I want to make a prediction on where within Bangladesh, right, the disease is likely to spread. So just like in the US, it was helpful to know that, say, Louisiana was early on, might have become an epicenter, but not Kentucky. So similarly, we need to know what districts in Bangladesh were more likely to be affected. So for that, we collaborated with various government agencies, got all of the data on travelers coming back into the country. So Bangladesh sends a lot of migrant workers to the Middle East, to Singapore, Malaysia, to Italy, right? And they were the ones who brought the disease back, right? But we had information on, like, the disembarkation cards that you fill out when you come into an airport. So we collected all that information to see where people were coming back from and what districts they would, or sub-districts they would end up in, to make predictions on where the disease might spread. And similarly, there's a different branch of government that hands out migration permits when people leave. And so we collected that information as well. So we were trying to kind of triangulate based on different pieces of information to make better predictions in real time. And then one other thing I'll talk to you about this a little bit, which is that early on, a lot of our, like if you think back to March, April, right, we were making decisions on the basis of these epidemiological models. Remember the Imperial College model that we heard a lot about that really affected and guided decision-making in the UK and the US, right? Now, the problem with the epidemiological models is that it's about the virus behavior, right? Now, especially when you move into the low and middle income country setting, you not only have to track how the virus behaves, but also how humans interact, right? So for example, social distancing, if you have a policy and then using the model, you want to make a prediction that if you just limit if you limit people going outside and transmitting virus to each other, what would happen to the spread? Now, in developing countries, you have to start modeling behavioral adjustments, like, are people really going to adhere to social distancing guidelines? Are you going to be able to monitor? Are you going to be able to enforce, right? Behavior matters. And second, the crisis is as much an economic crisis there as a public health crisis. So then you also have to monitor, like, what types of economic effects, deprivation, and possibly new types of health shocks and diseases that might spread because you're forcing people to economically distance themselves as well from the market. Right? So the economics matter. So we're trying to sort of enhance the predictions of the model as well as paint a more comprehensive picture about the right policy choices by merging the economics and the epidemiology. Okay? And then here's last two things. Okay, so down here. So regardless of your beliefs about the appropriate level of social distancing, should we be locking down economies or not, it was very clear that we need to get money in the hands of poor people, right? First of all, they're suffering, they need that support. And second, people can't social distance if they have nothing to eat, right? Even if you want to just have better public health policy, you need to make sure money gets into the hands of people. Okay? And now think about the challenge there. Okay, so in the US, what we could do is look at that Congress passes a $2 trillion relief bill. And then we look at last year's tax returns. We figure out, okay, who earns less than $50,000 a year, let's say, and we can send out checks to them or direct deposit or whatever, right? Now think about Bangladesh, where maybe 2%, 3% of people submit tax returns, right? In rural areas, people don't. The people who need support really don't, and they're in the informal sector. Okay, how do you identify who's poor? How do you send money to them? Okay, that's a complicated problem. And the trick that we are using right now is partnering with the major telecom service providers, Grameenphone, Robi, which is like the AT&T, Verizon of Bangladesh, and trying to get all their call detail records, because it turns out, all the data that I'm collecting here, right? I also have their cell phone numbers. It turns out that, I'm only collecting data on, let's say, 20 to 30,000 households, right? I can identify within those 30 to 30,000 who's poor, right? Because I have really rich data for them. And those people also carry around cell phones, right? And so it turns out, it won't surprise you to learn that poor people who are suffering and people who are not so poor, they use their phones somewhat differently. And their phone usage patterns leave some subtle clues as to whether or not you are poor or you're suffering, right? So just as a simple example, like the extent of the ratio of use of SMS versus actual phone calls, right, is very different among the rich and the poor. Okay. So then if you can figure out, who is, you now know the ground truth of who's poor based on my survey data, right? If you can uncover the cell phone usage patterns that are predictive of poverty and suffering and deprivation, then what you could do is train a machine learning model in order to pick out those subtle clues. And then once you have an algorithm that you feel confident that it's doing a pretty good job of identifying the poor, you could then turn that back over to the telecom companies, have it run it on their entire subscriber base, and voila, you have some indication of who might be poor. And after that, you might start sending them SMS and trying to get a sense of some sort of like self-selection and do you really need support or not, right? That was the only way we could think of identifying the poor in real time so quickly. And so that's where we're still sort of struggling to implement with the Bangladesh government, because it also requires, there's a lot of privacy concerns associated with getting people's cell phone records. And then finally, I'll say producing and distributing mass. So it turns out that the WHO, even throughout this period, just wasn't clear enough and vigorous enough in its masking guidelines. And because they say that no randomized controlled trial had yet been done on the effects of community level mass wearing norms, right? So we've now launched it. So in Bangladesh, we're running a trial of like community level mass wearing norms, and it's a trial that involves 750,000 people. Why is it so large? Because in order to, really, like after having talked to the chief scientist of the World Health Organization, in order to really change their guidelines, we need to establish that when you do establish community-wide sort of mask wearing, then that changes COVID prevalence. So that requires collecting blood spots and doing what's called seroprevalence surveys, and to look for antibodies of COVID to see if it was present or not in this community. And so we're in the middle of that. And what we've learned from that so far is that, of course, it's not just about the effect of masks, but getting people to wear masks is a challenge. Just like I was telling you at the outset, that getting people to use toilets is a challenge, right? So we're also experimenting with various strategies to get communities to wear masks. Okay, so we're at, I've spoken to about 20 minutes. So let me just give you one example of some work. So I've now given you an overview, and in the Q&A, if you want to talk about any of this in more detail, I'm happy to just like switch those slides. And I'll tell you about like one of the first things that we did on the modeling side and how it guided our thinking as to how poor countries and low and middle income countries should be thinking about this crisis. Okay, because that's the title of the talk, low and middle income countries, and I just wanted to give you a sense of why that might be different. So based on some modeling, I ended up writing a piece in the popular media, I should say, or the wonky media. This is a foreign policy magazine. And the idea here is, here's what was happening, okay? So unlike Ebola, Zika, and these other crises that we faced in the past, what was different about this one is that it hit the rich countries first. It hit like Europe and the US before it hit the global South, Africa, Asia, etc. And when that happens, what I noticed was that as soon as something happens in the US, that kind of sucks up all the oxygen in the media, and that's what all we hear about, right? The US strategy is this or that, or UK strategy should be, either like aggressive social distancing, or like Sweden's strategy, like just letting the virus pass through and developing herd immunity. And so, or we were hearing about South Korea's sophisticated strategies based on contact tracing, et cetera, and lots of data, okay? And then I realized what was happening in developing countries is that, okay, that's all we're hearing about. And, regardless of what developing country governments do, whether they, if they impose aggressive lockdown and social distancing, it's going to be bad because there's going to be a huge economic shock and people are going to die from other causes, and people are going to be suffering, right? It's going to make it look bad. If they don't impose social distancing, people are going to die from coronavirus, okay? So regardless, I mean, they were between a rock and a hard place. And when it's like that, what happens is that you just have to, you end up following whatever everybody is talking about. The US and UK is doing this, because at least then you have cover that says, you know what? Yes, people are suffering, but we did exactly what the world told us to do, okay? Now, what I wanted to look into to also give some political cover, right, is, all right, so US and UK are making decisions on the basis of these models, like the epidemiological model, like the Imperial College model, right? What happens if I start using developing country data and estimating those models, right? Do I get a different answer? Maybe I'll get the exact same answer, we should social distance. Maybe I won't, okay? But I wanted to actually do that analysis. So that's what I did. And I want to just give you a quick intuition for why you end up getting a very different answer. Okay? So one reason you get a different answer is that the risk of fatalities from the disease is very different in poor versus rich countries. And the reason for that is that the population, the age structure of the population is very different. In high-income countries, about 18% of the population is elderly, above the age of 65. In low-income countries, it's only 3%. And the reason is fertility rates are higher, so population's younger. Right? So given this six-fold difference, which is a huge difference, right? A 600% difference, you would have a lot more, coronavirus is just going to be a lot more risky in rich countries, right? So the benefits are going to be of aggressive social distancing are going to be smaller for that reason in poor countries. And second, another aspect of the benefit, remember, like think back to April when we were hearing about flattening the curve, right? Why do you want to flatten that curve? You don't want the death rate to exceed kind of the healthcare capacity in that country, because if it exceeds it, then you get lots of unnecessary deaths where people aren't getting access to healthcare, right? So you want to flatten the curve, delay infections, so that your health system can catch up, and so that's why we do it, right? But now imagine that in a poor country, in a rural area of South Asia, right, the healthcare capacity is like down here. In that case, right, if you delay infections, right, it's not that suddenly there's going to be some respirators or oxygen tanks that's going to appear, which isn't there, or hospital beds would appear, which isn't there at all, right? And so delaying infection is actually not as helpful when you put in developing country data in those exact same models. So that's why the benefits of like aggressive social distancing would be smaller in poor countries. And so you got to compare those benefits against the cost. Okay? And why is the cost different? It's because, when you impose social distancing, you also impose economic distancing. In rich countries, we can sit at home, get some relief payments, or get our work done at home. In poor countries, think about a day wage laborer. If he doesn't work that week, maybe his family won't get to eat enough that week. Right? So the cost of imposing social economic distancing can also be very different. So that's what we started tracking, remember, in my high frequency data from Bangladesh and Nepal. And here's what was happening. This is the early results that I reported in like early April, which is that this is what, this is hours of work, non-farm work, wage work, etc. There's some seasonal variation. This is the amount of work people normally get, because we have been tracking. This is why baseline data is so useful, right? That research infrastructure was so useful. We had all these data points pre-COVID, right, to see what people normally do. And here's what happened immediately post Nepal's lockdown, right? There's a huge drop, right? And then people were reporting, not that they were worried about their health and safety, they were really worried about their income shock and food insecurity, right? And for food insecurity, we see that like normally the seasonal variation in food insecurity. So like in the pre-harvest lean season, it's very high. And then after the harvest is better. But during a harvest period, it started approaching the lean season levels. Okay, so that was the cost. So then the point here was that thinking about the costs as well as the benefits, it's not clear whether or not every single country should follow the exact same strategy that the US or Europe is following, right? That we need to think about the best fit policy for any given country. And the point of doing this analysis was to say that, look, situation could be different. It depends on the data. We can't just blindly import the models that are being estimated on US and UK data. We got to make some tough decisions that make sense for our country. Okay. Let me stop there because I've just talked for 30 minutes. And let's spend the other 30 with Q&A.
Great, thank you. So I'll feed some of the questions that have been coming through. Going back to your discussion on your earlier slides, we had a couple questions around the phone record data and some interest in that. So how reliable do you consider your data in cases where you used phone records to determine economic status of individual people? And then I guess another phone related question, what percentage of the population in Bangladesh does not have a phone, and how do you address that population?
Okay, good. Let me see if I have some slides here about phone records. Yeah, good. These are very good questions that we've had to grapple with. And let me now get into the detail of that particular strategy so that then if everybody understands the detail, then I can start answering these questions. Okay. So the first step of using or devising a system like this, this machine learning algorithm using phone records to identify the poor, is that we need to first talk to the government and figure out who is it that they want to target, right? And that first step, you actually could have different goals. So the first one would be, you want to target the people who are extremely poor, or it could be that you want to target the people who are suffering the most during this particular crisis, who face the largest income shocks, okay? Or you might want to target those whose livelihoods depend on mobility. We want to send them support so that they don't move around so much, because when people move around, that's when the virus spreads and it becomes harder to control, okay? So let's say you identify what your objective function is. So step one, you identify that. Step two is nothing to do with phone records. I have data from my own data sources, like, the surveys that I do. For about 20, 30,000 people, I know a lot of detail about their lives. So I know who's poor, who's not. I know, given the phone surveys, post-COVID period, I know who's suffering right now versus not, right? So then for those 30,000 households, I can create an indicator for, let's just pick, if you want to target the poor, I can create an indicator for those 30,000 households. Here's a person who's poor and here's a non-poor, okay? So now the next step is, we get people's phone records and match it, merge it to the poor, non-poor, like this eligibility criteria that we have from the survey data, okay? And what the phone records look like are like, this is what a call detail record looks like. Every single call gets logged. And from that, you can start extracting some features, like the number of calls you made, the total expenditures on airtime, duration of weekend calls, how many cell towers you visit, because that might be helpful for identifying migrants, things like that, right? But also, like, we know who your network is, who you're calling, we then know who they're calling, and it turns out the structure of your network, what type of phone calls they make, that's quite predictive about your status, okay? Now, so once you can extract like literally hundreds or thousands of different features from these phone records, okay? And so once you do that, what you can do is, it's hard to intuit for a human, like exactly what would be predictive in any given context of poverty, like what are the subtle changes in phone records. And so we just deploy a machine learning algorithm to get into that. All right. So then what you do is you merge the phone records with the phone survey data, you run the machine learning algorithm, and the algorithm tells you, okay, if I look at feature 1, 27, 58, and 158, those are the most predictive of people's poverty. Like, that's what picks out the poor and not the non-poor. That's what helps you distinguish, okay? Now the question here is that's going to lead to error, right? There's going to be both inclusion error, where you're going to think based on phone records that somebody is poor when they're really not, they don't need the support. You're going to have exclusion error, where somebody doesn't really need the support, but they do, okay? So how do you, so of course that's a problem, and we need to have fixes or checks for this. So there are many different checks that we do. So one is that, let's say I have data on these 20,000 households that I can use to train the model, right? What I can do is leave a holdout sample. So imagine that I only use data for 15,000 of those households, and I train the algorithm. Then I can check in the other 5,000 where I know who's poor or not. I can make predictions based on my algorithm who's poor, and I can see how well the predictions match up to actual, right? And if I see I'm going to make some errors. If I see some systematic errors, such as I'm missing out, say, women, or I'm missing out certain underrepresented groups, right? Then I can go back and adjust the algorithm in order to correct for those systematic biases. So the first strategy is a holdout sample. The second strategy is that you don't want to leave everything up to a machine, okay? Because it's going to make errors. So what you can do is say that, look, the machine is helpful for us to identify with high likelihood. This is a high likelihood poor person, medium likelihood poor person, etc. And then you can add some human elements to it, which is we send out SMS messages to the high likelihood, to the medium likelihood guys, ask them some questions, and do some self-targeting, right? And get some more information from them, and then refine our system, right? And of course, you're going to definitely miss out on like people who don't have cell phones, right? So you need to have a separate system, in parallel for like the 10% of the population that doesn't have access to phone records. But the key reason why we're going in this direction is that the government doesn't have information on 90% of the people. I don't have information on 90% of the 150 million people, right? the cell phone companies do, because so many people carry around phones. That's the trick that we're using. Okay? And then one final check is that, we're not going to go deploy this all at once everywhere, right? What we end up doing, like the agreement with the government is, okay, so we come up with a system, we're going to try and deploy it in certain sub-districts. And in other sub-districts, we can go with any kind of traditional method you want to use, which is, politicians like to make lists of people who should get relief and then hand out the relief. The same way that Trump, said that he wanted to sign all the checks. His signature should be on all the checks that go out to the U.S. Households that needed relief. And so we can, what we can do is run it as a randomized control trial. You try the traditional system in some places, the novel system in other places, and then collect data on whether people are feeling like, yes, this is working for them. They feel the system is fair. What's happening to their food insecurity, et cetera, et cetera. So Laurel, do you want to pick up? Or, yeah.
Yep, we have a number of them coming in. So a little bit of a different tack. So how do you think some of the culturally driven lack of adherence to safety protocols during COVID can be addressed?
Okay, culturally driven. Yeah, so I think, to answer that question well, I need to understand what culturally driven issues are. So
okay. One example given by the person who asked, they said, for instance, going to mass prayers.
Yes. So, the thing is, religious sensibilities, of course, matter, right? And that's one of the things that we had worked on. So, when I said that we were passing out information through village imams, right? What we ended up doing was we first, talked to sort of the main imam in the Imam Training Academy in Dhaka, the capital, and had him endorse a message, right, of why during this period it's okay for you to not go to the mosque and pray at home. And also had him record a video message, which we're now trying to deploy via like WhatsApp and Facebook. And also, we had an Islamic scholar who looked through Quran and Hadith and like all the passages that say about what changes to behavior are okay and granted, like during periods of crisis, right? So we had all this information. And so when we called up the imams, we had a careful script that looked at all these things. So you have to understand what is important to people and try to communicate in ways that will be sensible to them.
Okay. Another question, as high-income countries do have pockets of low-income communities and areas, would you recommend reconsidering strict social distancing in those areas as well?
Yeah, okay, so what have we learned from US data so far, okay? It turns out that, I was talking to a journalist earlier today about exactly this. I might be answering the wrong question about what the journalist made me think about, but it was a related question, which is that, what we've learned from the US data is that it turns out it's not just about lockdowns, right? Like people telling you to lock down and that's when people stay at home or not. It turns out that irrespective of the guideline and the imposition by the government, right? Rich people, when they don't feel comfortable that the virus is under control, they've stayed at home, right? And when they've stayed at home, then in those zip codes, which are generally like wealthy zip codes, the poor people who are living in and around those zip codes actually suffer the most. Okay? And the reason is that the rich people aren't out spending money, right? Like there's a lot of the economy that doesn't work well, like the service sector, et cetera. Okay? So I think the way that I talked to a journalist today about this is, it was important for us to have sensible policies in place, clear guidelines, clear messaging, clear communication, strong leadership that got the virus under control. That would be the best way to address, because it's a twin crisis. It's not like, some people talk about the lives versus livelihood debate. That's a false dichotomy, right? If livelihoods are at risk, you can't control, you won't be able to control the virus. And if lives are at risk, it's not like people are going to come out and undertake economic activity, right? So we really needed much more clear-eyed leadership in order to get the virus under control more quickly. Some states in the United States have done well. Connecticut is one such state. We've been very lucky that due to our proximity to New York, we had a big wave, but the state made some very good management decisions, and so we were able to open things up early. And so on the side, actually, I now also run. My wife and I founded a nonprofit, which requires running a small business here, and we've been very lucky that we've been able to open up, and it's been safe to do so without additional harm. And in states where the virus was never under control, right? That's where people are continuing to suffer.
Okay. Would you be able to translate these insights from Bangladesh to other lower middle income countries, and what are some of the relevant factors in determining how translatable these findings are?
Okay, sure. Yeah, I mean, part of it is that, like, even some of the data I showed you today is that you are collecting information in many other places. So Sierra Leone, Nepal, and then I have other partners. We put together data from about 10, 12 different countries to write papers on what the nature of this crisis has been across the developing world, both in low and middle income. So part of it is that you need to, the more data, the better, right? But let me answer your question in a systematic way, because the question that you're asking actually has a name for the statistical issue that it leads to. It's called external validity, right? You can have a well-designed study that's internally valid for the population that you're studying, but the answer that you get may not be externally valid. It may not apply to a different population, or it might not apply to the same population but a different time period, like next year. Yeah. And so where do we have like more external validity concerns? So let me go to that mask study. I don't know if I have any slides on it, but essentially so there are, so the mask study, okay, is that there's going to be treatment areas that receive distribution of masks and control areas that don't, okay? And there are two stages of research that's very important here. Stage one is, how do you get people to wear masks? How do you change community level mask wearing norms so that everybody's wearing a mask? Okay. So you need to get people to wear masks. That's stage one. And stage two is that conditional on people wearing masks, does that actually reduce COVID transmission? Does that improve health outcomes? That's stage two. That stage two is a public health question. It's about how masks interact with the virus, like whether it traps particles and whether it makes humans healthier. Okay. So that question, actually, you collect that data in Bangladesh, and that has high external validity, because it turns out that the mass material and the virus, and their interaction, there's no good reason for us to expect that would be fundamentally different in Bangladesh than in other places. It's possible that due to temperature, humidity, there might be small differences, but like based on our existing scientific knowledge, that's not a primary concern. However, if you think about the first stage question, so we're doing a whole bunch of different things in Bangladesh in order to make sure that people wear masks, like various types of mask promotion. So here we are, we're monitoring people's behavior. We have mask promoters who stand at like village, entrances to the village, etc., reminding people to wear a mask. We distributed the mask. We have a particular design on the mask with the flag. We have we've had a partnership with the community leaders, with the imams at the mosque, with the committee of owners at the market, right, to enforce mask wearing norms in the mosque and the market, etc. Like all those strategies that we're using in Bangladesh in order to get people to wear masks, those don't necessarily easily translate. So that's where you have more of an external validity issue, right? And so what I've chosen to do now, is that in Bangladesh, we're running this enormous trial on both stage one and stage two. But since stage one, it's, you want to try it out in different places given limited external validity. So on stage one, how to promote mask use, I'm actually replicating that trial in Mali. So the idea is that you want to answer those questions in different places, right? Depending on where you feel like you have limited external validity, so that you can most effectively and cost effectively deploy research resources to answer the questions that need to be answered in many places, versus answer the question that doesn't need to be answered in many places. You just do it in one place and you do it well there.
A little bit of a higher level question. When dealing with a quickly evolving situation like COVID-19, how do you find the right balance between the data you have available now and the intuition you have for what might come what might come later?
Okay. Um, yeah, so intuition matters, data matters, and being empirically focused matters. But theory also matters, like economic theory that or social science theory that helps you make predictions. And um, this is the case as I mentioned earlier that look, this was unanticipated. This is also novel. We haven't experienced something like this in our lifetime, right? So it's difficult for us to solely rely on data looking back and and uh, and make solid, confident predictions. That's why collecting a lot of new information was really critical during this period and collecting it quickly. But I also mentioned that when you collect new data, say post-April, right, post-COVID, post-lockdowns, right, for us to understand what we're seeing in the data, we do need to look back and look at how those same people might have behaved prior to the crisis to understand those changes, right? So let me give you a simple reason for it, right? So COVID hit during a fortunate period in South Asia, which was soon after the harvest. So when you go and try and figure out, what's the food insecurity situation there? Now, I might actually have a slide on this that'll help me make this point. Let me see if I can find it. Yeah, this slide is helpful. All right. So COVID hit. COVID hit like during this period, right? And then the black line here is like lines from earlier years. So imagine 2019 and earlier. Okay? The black line tells you food insecurity and how it varies over time. So you see that in any normal year, food insecurity peaks in September, October, right? Whereas COVID hit us in like April, May. Okay? So the issue here is that when I observe food insecurity at this level, right? And if I only had data, pre-COVID data, if I didn't have any pre-COVID data, I don't know, okay, is this normal food insecurity or not, right? If I only had pre-COVID data from these two data points, these two blue dots, right? Then it would be look like, oh, look, COVID is not much of an issue because, right, the food insecurity doesn't look any worse than the pre-COVID period, right? It's because you have all this data, right, on the same sample of people that you can then start understanding like, oh, there is an excessive shock going on at this time, right? And it also helps you gauge that moving forward, right? Like already COVID is a problem in terms of creating food deprivation. Now, what will happen, like if um, if this crisis continues into like October, November, when food insecurity is higher, right? There you'd have the combination of the normal pre-harvest lean season, and on top of that, the COVID shock. Okay? So this is an example of why the new data is important, but having old data on that same population is important, and understanding the theory of how and the intuition in your language of how our regular year looks and seasonal variation in the regular year looks and how our current data compares to that, that's also important.
Another kind of crystal ball question. How long do you see a country like Bangladesh being impacted by COVID-19? What future problems do you see arising that are not currently an issue? I think you just touched upon one, and just understanding sort of the cyclical variation of something like food insecurity, but are there others that come to mind?
Yeah, so I mean, this is another piece I wrote which made the point that I currently made, and there's another point that I made there that help me answer your question, which is like right now, when you have this excess food insecurity, what's happening is that people are using their money to buy food, right? Now, the thing is that in a normal year, right, this is a period where they would be making other investments because they wouldn't have such food insecurity, right? So for example, they would be buying fertilizer, or they would be saving, or they would be migrating during this period, generating some savings that's going to be helpful for the lean period that's going to be coming in 2021, right? And given that you're just now, like dealing with your income shock and your food needs, you're not able to spend money on investments like fertilizer, right? Which may end up showing up as lower productivity during the next harvest, and that's going to perpetuate poverty, right? That's one. And I just lost my train of thought. what's the other issue? Oh, the migration. That's what I wanted to talk about. Okay. So this is a period when people normally migrate and they work in cities and they build up, some buffer stock of savings. Okay. Now suddenly, a lot of Nepalis migrate to Indian cities to work because that border is open. Now suddenly, because of India's lockdown, borders get closed, and the Nepalis are not able to migrate. So normally, you would be earning remittances during this period, and those savings are not happening, which is going to show up as a shock in the future. Right? So it's important for us from this data to also, through a combination of economic theory and data, figure out, okay, what are the things that we need to worry about, right? Given the way that people behave in any normal year.
Thank you. Back to the cell phones. Did any ethical questions arise as you considered using cell phone records to determine poverty levels in Bangladesh?
Yeah. So the biggest challenge of using that data is the privacy laws in the country. So currently, there is a government agency that's able to access this data, but only for anti-terrorism purposes. So people use cell phone. Many countries, it won't surprise you to learn, use cell phone records to track, potential terrorism threats, etc. Right? And so then that means that, like, if cell phone records go into the wrong hands, right, that might cause some unanticipated problem in the future. So we are trying to be extremely careful with our handling of that data. So it turns out what we finally decided to do is that there's another government agency within Bangladesh that's working on COVID response, and they're the ones who will get access to the data. It'll live on their servers, and as a Bangladeshi citizen, right, I will be working as a consultant, like helping them do the analysis and allowing them to participate in the analysis. And we're also this is probably a level of detail you don't want to hear about, that some of the analysis will be done at a lab in Berkeley where my co-author is, who had a team of computer scientists working there on the machine learning. Some of the analysis at Yale, and so we're just de-identifying all of the data sources before it gets shared anywhere. And in terms of other ethical issues that I pointed out, you could systematically make errors and exclude certain groups like women, right? And as I pointed out earlier, that we have a bunch of checks and balances in place in order to, we want to first anticipate the problem and address it. Now, not accurately targeting people who need support, that also has ethical complications. So for me, when I think about my own ethics, saying that, oh, I'm not going to touch this data, I'm not going to do anything, that also has some ethical implications, which is I'm going to be leaving it to politicians to decide who gets support or not, and that may not be the right outcome for the people of Bangladesh.
Thank you. I think we probably have time for one more question. Do you see any of your existing research in this area being relevant to healthcare questions more broadly, with the ability to be applied beyond just insights into COVID-19?
Yeah, so the hope is definitely, okay, so the hope is that, this during this COVID period, the silver lining was I've realized that there's an immense amount of talent in my country, right? That was dormant, and people doing work in different areas, and this crisis forced us to all come together. It also forced a much deeper connection between me as a researcher and then the government of Bangladesh. And we're trying to set the infrastructure up in order to keep that going, to not just respond to this particular crisis, but to set up work streams that will be helpful for the country in general, to tackle the future crises. Right? So just to give you one tangible example of this, okay. So when I'm doing these, collecting these blood spots in order to test for COVID transmission, right? So after talking to, so this is a Yale team and Stanford Medical School team that's collaborating in order to do this work. And then just as we were trying to raise money, I got in touch with somebody from the Harvard School of Public Health who works in Bangladesh on the public health side. She's an epidemiologist. And she got extremely excited that, look, if you're collecting all these blood spots, then we can do population level surveillance of not just COVID, but also dengue fever and other tuberculosis and other diseases. And though that's going to be really helpful for any future like vaccine deployment, et cetera, right? So then, we've decided that, look, we've built this in huge infrastructure that apparently, the 45,000 blood spots we'll collect, nobody's ever done anything like that, and the kind of wide geographic coverage we have around the country. And that's a good opportunity for us to take advantage of the economies of scale and do tracking of other diseases. That's also important, right? So there are these other like tangible benefits that come about, as long as you are in a position to take advantage of the economies of scale.
Great, and I think that that's a good place for us to end. Professor Mubarak, thank you so much for your time tonight. It's incredibly interesting, incredibly timely right now, and hopefully gives the group here tonight a good sense of what it's like to be sitting in the Yale SOM classroom, kind of on the ground. So thank you. Thanks so much for your time.
And thank you, Laurel, and the whole SOM team for organizing this, the admissions office for organizing this. And I wish, I had a chance to meet all of the attendees. I see somebody writing in from Brazil, boa noite. Somebody writing from Indonesia, terima kasih. And hopefully I'll get to meet you in person one day. Okay.
Thanks so much again. We will be hosting another few of these master classes throughout the next month or two. Our next one coming up is on October 22nd with Fiona Scott Morton, who will be giving a master class on mergers and competition. So if you check out the Yale SOM events page, you'll be able to see that, as well as our ongoing small group student conversations. We have topical student panels and ongoing admissions Q&As as well. So hope we'll have a chance to connect in a number of different ways over the coming weeks and months. And thank you so much for everyone for joining tonight. And again, thank you to Professor Mubarak. Have a great night, everyone.